Only mode.
Good morning. Thank you so much for attending our Komen Ozark grant writing webinar today. This is a mandatory webinar, so we appreciate you listening in on this. This will be recorded, so if there's anything that you want to go over again or want to listen, or another staff member that couldn't make it today that's helping with the grant wants to listen, we will get that out to you guys as well. First, I am Lauren Marquette. I'm the Director of Mission Services, and I have with me today Sarah Fatak, who is our Grants Chair, and we are going to go through the grant writing webinar. At the end, in your little dashboard toward the right, if you see where it's questions, you can type in a question and submit it, and Sarah and I will get to that at the end. So if nothing else, we're going to go ahead and get started. And again, if you have a question, just type it up at the end. We are, like I said in the email, we will go over the GEMS training at another webinar date and also record that as well. So if you've submitted a grant with us, it's not going to be, there might be very minor changes, but it's nothing that you need to sit through a whole hour of training to see again. So if you feel comfortable with the GEMS part, then you can go ahead and skip that webinar. But if you've never entered one, or if you have a new staff member, or if you just want some extra help with it as well, you can certainly sit in on that. It'll be sometime next week, and I'll get that date out to you guys. Today we're going to be going over the community profile, which guides us as our affiliate to what our funding priorities will be and where we'll be spending our funds. We're going to review the RFA because there were a lot of changes made this year, so we definitely want to spend time on that. We're going to talk about how to write the application and then just discuss a few other things as well. So Susan G. Komen started as a promise between two sisters. It's a very large grassroots movement that started in 1982. We were so proud to be a part of it because it is definitely grassroots, and it's local, and it's a national cause with a local promise as well. So just know that every dollar that is raised in our area stays in our area and goes to grants like some of you all are funded with. So we're very proud to be a part of this organization and have a lot of the national resources as well. Our Ozark Affiliate Service area, we have 8 counties in Arkansas, and we have 2 in Missouri, and this is what our area looks like. So the community profile, like I said earlier, is a comprehensive assessment that Komen Ozark conducts in order to learn about our community and to make the best decisions about how our affiliate can use our resources to make the greatest impact. And this is a very large undertaking. I know that some of you might have asked for help in doing focus groups or getting some more information about your particular area. If I haven't asked you yet, I will be asking you, so just be on the lookout for me. And what the community profile gathers is the first piece, the quantitative data piece, is the piece that you all do have access to on our website, and our piece has already been approved by Komen National. So it is approved word for word, so that's what we're using this year to kind of change up our RFA a little bit. And the quantitative data, it collects and examines breast cancer statistics, and those statistics come from the Healthy People 2020, so it's a national research that they're pulling from local areas. And Komen National this year had epidemiologists who went ahead and sifted through all of our data to show us what the priority areas were. And then we took additional data from state and local data to look at the priority areas, and then look at the data we had to come up with our selected target communities, which we'll talk about in a minute. And also that the quantitative data piece, like I said, it examines social, demographic, geographic characteristics that influence breast cancer outcomes. And then after thorough examination, like I said, of the statistical population data, that's how we pulled out the target communities. So I want you all to know that our selected target communities were pulled straight from data. So it's not, well, we think, Sarah and I think that it should be here, or we think it should be there. This was pulled straight from evidence-based information that we had. The next piece of our community profile is a health systems and public policy piece, and ours did just get approved, but you won't have it available to you yet. And it will look at all the breast health resources in the area and the public policy of our state and our local area to see what the story looks like about continuum of care. So we, our grant committee actually got together and picked out different counties for each person to examine, and they examined things like, what screening resources existed and what treatment resources existed. And, some of you all from smaller communities know that, you might not have had anything that went on that sheet because everyone in your area drives somewhere else to a different county for services. So what Komen National will be providing is they're going to map out all of that information into a map, so then you'll be able to see what the services look like and what resources look like in our area. And also that the public policy and health systems piece observes the potential strengths and gaps in access, and will utilize a quality of care in the healthcare system that can affect a woman's health. So we know, you all might have screening here, but there's no diagnostic and treatment. So we need to have a plan of how we're getting women from one area to another to make sure that that continuum of care piece that Sarah will talk about later is complete. The other piece that we're working on currently is a qualitative data. We're gathering information from healthcare providers and women in the community about their experience within the breast health continuum of care. Currently, right now, we're working on focus groups, and we're going to be doing surveys and interviews also to make sure that, we see what the data looks like, but why is that happening? So we're in the process right now of conducting those. Like I said, I've called on some of you all to help target certain women and areas with focus groups and surveys, and I'll probably be calling on the other of you on this call later. So I appreciate all your help with this. So the piece of the community profile are pulled together to have an affiliate mission action plan. So it emphasizes overarching themes of the report, specific needs based on the data in the target communities, and the strategies and objectives that will be implemented by the affiliate in response to those needs. So, a lot of what we do is actually giving out funding for those needs, but also it might be, the affiliate steps in certain spots, or we do provider education, or there might be something that comes out that the affiliate will take on as a program as well. But it will be, what we're doing with our money, what we're encouraging people to apply for, and that kind of thing. So the quantitative report section, like I said, is the only section that you all will have access to, and it can be found on our website. Like I said, the affiliate is conducting focus groups for the qualitative data phase currently, and the entire report will be available to the public probably mid-2015, because we still have different sections that have to be approved, and it certainly does take a while. So once we have that final report, we will send it out to you all. It's a great, for all of you on the call, somehow you deal with breast health in your community. So this piece and this profile will be a great tool for you all to use, if not even for Komen grants, but for other grants as well, because we have data and backup qualitative information too. So it should help kind of make your programs, evidence-based and data-driven. In our quantitative data selected target communities, which you could read about why there are selected communities, but like I said, they're all evidence-based, is the first one is the Boone, Newton, and Madison counties. This section of area in our service area actually lit up the most as far as need goes in the Helping People 2020, and a lot of it dealt with access to services and the continuum of care. The second target communities is Stone and Taney counties in Missouri. And then the third is the Hispanic and Latina population in Benton, Carroll, Sebastian, Washington counties, because these areas have the greatest population of Hispanic and Latina women, and also had high population of those who are linguistically isolated, and some other reasons too. So like I said, please read that report before you go on. Okay.
I wanted to.
Oh, we'll go back.
Lauren's going to go back another step because I wanted to make a comment or two. This is Sarah, PATAC, and I wanted to make a comment or two about these selected target communities. Lauren spent quite a bit of time here talking with you about the detail of the community assessment. And to just kind of sum it up, basically this is the roadmap that the Komen board uses to make plans for the future and to plan on how they believe we need to spend grant money, how they believe we need to spend the budget within the Komen budget so that they might, as Lauren said, focus the Komen office on a particular project. And so I think it's important to go over this very carefully, and for you especially to understand that these are the targets that we will be looking for in your grant applications. I'll start with number 3. The good news is that we have made progress overall in Benton, Carroll, Sebastian, and Washington counties over time. And the bad news, I guess, is that that means that we have been able to identify that there is a group of people we have kind of left out of that progress, and that would be the Hispanic and Latina population. So for those of you who are writing grants for the Benton, Carroll, Sebastian, or Washington counties, you must include outreach to the Hispanic population in your application, or it will not be considered. Boone, Newton, and Madison, Stone, and Taney counties have not yet met the higher expectation of care in general for those counties, and so those of you who are writing grants to cover those counties can have a more general application. Certainly don't need to leave out the Hispanic population, but if your application is general and does not focus on any particular population other than those who are uninsured or underinsured, then your grant will be considered. So our funding priorities, these are the areas that are important for you to include in all of the grants. One is access, and access can take into consideration several things. It can be financial access, and it can be transportation. It can have to do with when services are available to people, whether or not they have child care or would need child care, whether or not their employer is going to let them off to have a mammogram, and what the consequences might be to that employee if they do take a day off simply to go get their mammogram. I know that there are some businesses out there that count every single day off as a score, if you will, against the employee. And so I know of women who have young children, and they expect those young children to get sick sometime during the year and have to stay home with them from work when they're homesick. And so those women can't really afford to take a day off to go get a mammogram. That's an access problem. And so those are the kinds of things that might be important in your community that you need to look into and try and address. A second priority is the education and awareness, especially for those counties, Boone, Newton, Madison, Stone, and Taney counties. Those are general education issues that you may need to address in your grant. How do you reach women who are not aware of the value of screening mammograms, are not aware of the signs of breast cancer that they need to be addressing, are not aware of the insurance opportunities that they may now have that they haven't had in the past? So those are important things for you to consider in your application. And then for Benton, Carroll, Sebastian, and Washington counties, you will want to find some focus on the Hispanic Latina population.
And also, too, I want to add is that in the education awareness, like we said last year, that, we, just because you're in an area and you give out a few brochures doesn't mean that you're necessarily really conducting that education awareness that we really need our grantees to be conducting. If there is a way to track the statistics of the women you're reaching, like if you have, say you are at a health fair, because that's important in some areas, and we definitely understand that. So, maybe you give women a quick little quiz, or maybe you're, signing up women to get a mammogram right there with Komen funding, or if there's something that you're actually changing behavior or changing knowledge on at a health fair, then that's fine. But we don't want we want to make sure that we're very targeted and specific, and we want to see that, women are taking steps and changing behaviors because of your education awareness program. So, we're not just going to fund a fee for a health fair if there's not evidence-based of what's being changed and taught that's included with it.
A third funding priority is patient navigation and advocacy. This would be patient navigators, but it can also include coordinators who help patients get from one appointment to the next, getting their appointments scheduled, and that sort of thing. And then a fourth priority that we are beginning to focus on because we feel we have the opportunity now that we do not have to spend all of our money on patient care, on services. Now we have the opportunity to focus a little bit on survivorship. And that piece is up to your own creativity. There are lots of opportunities out there for improving women's health after they've been diagnosed with breast cancer. There are a lot of issues that women can face. Their relationships with their significant other, their change in life focus because they've had a life-threatening disease. There are some women who suffer depression after they have finished their treatment because they recognize that their life has changed, but they have yet to really focus on how to get their life back into a normal pattern. So talk to some of your survivors out there and in your community and ask them what would have been valuable for you right after your diagnosis with breast cancer, and that's a great way to develop a program for your grant. So kind of new to the RFA is how we are, the guiding principles that we are using to ask you to develop these grants. We need for you to focus on these four areas of focus. What is the impact that your grant is going to have? Don't leave that up to our imagination. Be specific about how you see this program that you've developed is going to impact the community, specifically breast cancer patients and survivors. Do you see that impact being immediate? Do you see that impact long-lasting? Your educational programs in particular, as Lauren was saying, handing out a brochure is one thing. Giving a woman a little quiz and then calling her 3 weeks later to see if she's made her appointment for her mammogram is yet another thing. That's significant impact. So consider that seriously, and do be very specific in your writing as to how you see the impact of this grant. Collaboration is important. We all know that we have, when we work with others, we can extend what our grants can do and what our services can do. So seek out other grantees and other agencies in your area that will collaborate with you to help keep the women that you're dealing with in a healthier place. Cultural competence. Now, cultural competence can mean many things to many people, but one of the things that we want to be sure that you understand is that, especially those that are addressing the Hispanic Latina populations, is that this is going to mean translators. It's going to be materials translated into Spanish. And in addition to developing an understanding of how the Hispanic Latina population sees healthcare, and especially preventive healthcare, and finding ways to get into that population that will be acceptable to the population you're addressing. That's going to be true for any of the counties, but in particular the Hispanic Latina. And then shared learning. How are you going to share what you've learned, share what you've developed with other potential grantees as well as your community, so that we all have a better understanding of what the needs are in our community and what's successful in trying to address those needs. Especially for those folks in the Benton, Carroll, Sebastian, and Washington counties, Komen has developed a new breast cancer education tool for Hispanics, and there is the website that you can find that tool. Use that as a resource. This graphic may be familiar with you from the past. I will explain kind of the center, and then we'll go to the outside. But for most women, it is ideal that they enter into the healthcare system for screening. They're not having any problems, and they recognize they're age appropriate to begin to have screening mammograms. And so they seek and have the screening mammogram. They also seek and have a breast exam by their healthcare provider. And assuming that there is no problem with either the mammogram or the breast exam, then they go into the follow-up and survivorship category, which really just sends them right back into screening, assuming that nothing happens in the meantime. Those who have screening, either a mammogram or a breast exam, and there is some abnormality found, they go into the diagnostic category. Oftentimes, most of the time, that diagnostic workup ends up finding that there is no cancer. So those patients go into follow-up and back into screening again, assuming that nothing comes up in the meantime. But some of those women go on to treatment. Some of those women from the diagnostic category are actually diagnosed with breast cancer, and they go into the treatment category. And after their treatment, then they go into the follow-up and survivorship. So as we mentioned before, this is where we are beginning to put a focus, and that is on survivorship. So you want to think of those patients as they are leaving their treatment, what is important for survivorship. But another piece that is important that I have to admit, even being in the medical community, that sometimes those people who've been diagnosed with breast cancer end up losing track of their appropriate follow-up. And so we want you to be aware of that, and in particular in your navigation programs, make sure that there is some focus on helping that patient to identify what's important specifically for her in follow-up after having been diagnosed with breast cancer and in going back into the screening category. So that's kind of how this wheel works. Obviously, there's education surrounding all of that. Even those of us in the medical field realize that we miss out on sometimes those opportunities to help patients understand what important follow-up is. So even a focus on educating medical staff about what it's like to be a survivor of breast cancer and the assistance that those breast cancer survivors need, that could be an important focus in your grant as well. Not just, my point being, not just survivors and patients, but the community and the medical community specifically. So do include the education plan that you have, how this is going to, this program is going to help to improve the education. And that's a part of, going back to the guiding principles in grant making, that's a part of your shared learning. How, an example of how you help to elevate the care for breast cancer patients in your community, and therefore the health care of your community as a whole. And so this is just kind of a follow-up from that graphic. Describe in detail how you think your patients will follow through that entire cycle, and who is it specifically that you will refer patients to assure that they do follow through that cycle. And here are some resources for you that you may want to use in developing your application. The quantitative report that Lauren talked about earlier is, the website is where you can find that is listed here. And then as you're developing your budget, I'm sure if you've written a grant application before, you know that Komen requires that for healthcare services you not pay more than 130% of what Medicare would pay. And so this is the website that Arkansas Medicare uses to pay their bills, and so they have the prices that are allowable. I'm going to say you will find my email address at the end of this webinar, and if you would like, I'd be more than happy to help walk you through that. I went to it yesterday, and it is a little bit worky if you're not in the medical field, so feel free to give me an email. Give me plenty of time to be able to help you before your application is due, but I'd be happy to help you work through that and figure out what the costs are going to be.
Okay, so now we're going to get a little bit more into the application itself, and I'll say this a few times, is that your application is due November 11th, 2014 at 5. So when the clock hits 5 o'clock, you will be locked out of the system. So please plan accordingly. And I will tell you that in the system I can see the progress of people's applications, and those of you who have held or currently hold a Komen grant know that I love to harass people because it makes me nervous for you all, because I want to make sure that you get in your application on time. So just know that I will be giving you some reminders, but put that on bold in your calendar. And also in the GEMS program, a lot of times we have run up against kinks, and I think just about every applicant has had, just to be honest, has had some type of kink in the system. So whether it was user error or it was a system kink. So please plan, to finish early. You still also have to have your authorized signer to sign off on it. So please give them the deadline. And if you need to, stand over their shoulder to sign off on it. Just make sure that it's in by that date. So a lot of the stuff that Sarah was going over with our new parts of our RFA and the new section about continuum of care, it really gives you all a good opportunity now to start really planning out your proposal. And that might be talking to current patients, and I might be talking to people who are currently using services of you to see, this is what we're doing, but what suggestions do you all have? Like what would you think would be helpful too? Because we can plan all these wonderful programs, but if we're not taking into consideration if they're could be implemented well and that the public will use them, then what's the use of planning these great programs then? So make sure that these are programs that you're asking for funding are going to be able to translate within your community. So the proposal, we actually don't ask for a formal proposal, but I do really suggest before you start writing your grant to get at least an informal proposal and talk to your stakeholders about, this is what we're asking for, this is why, this is what the timeline is going to be, this is what we want to address for like our objectives and goals, so everybody knows ahead of time what you will be writing for. Some organizations that have a lot of people that sign off on things or that'll be touching things, it would be helpful for the person writing the grant that any changes are made early, so they're not you finished it and you're excited about it and then they say, wait, we didn't include this. So make sure that all the stuff that everybody wants to include in your grant in the beginning, and then prepare that proposal. And I even think it's good to all get together in a meeting and hash it out together. And especially keeping your authorized signer in on what's going on will help at the end piece when they sign off too. Your abstract on the application, I cannot stress this enough. So please spend some time on your abstract. I say this every year, and every year we do get some applications that you can just tell they haven't spent a lot of time on the abstract, because this is why it's important. When our grant review panel goes to the day-long meeting, which we'll talk about, Sarah will talk about that process later, some of the grant reviewers only have your abstract to go by because they didn't review your entire grant. And that panel discusses everybody's grant. And so it's important for them to have a good snapshot of what your program includes. And also that abstract is what Komen National puts up on their website of grants and what organizations are doing. And we also pull that a lot for different things that we do and market. So, please make sure that the grammar is correct, and that it's easily understood as well. So you even have someone from the outside that doesn't know anything about your program maybe read it and make some suggestions. If they get confused, then maybe you need to make it a little more clear. But to include in that abstract is the purpose of the program, talk about your key activities, and talk a little bit about how you're going to evaluate those key activities, and then what the impact of your program is going to be. And I know it's a short amount of space, but you can do it very succinctly. You might have to do a lot of revisions for it, but I have faith. And like I said, the reason why it's so important is that the review panelists will read, who do not review your grant, will read your abstract. So that's what they have going for your grant. That's all that they know. So please make sure that you do a very concise and succinct job on that. So on your objectives, we really want to make sure that anytime you give an objective that you're very specific, and it's a SMART measures, to make sure that we know exactly what you're doing, how many people you're reaching, when are you reaching them by, and when will you know that you've reached your objective. So we don't want to get an application that says something like, our objective is to reach out to this county. Well, that doesn't tell us anything. I mean, that isn't like what's the number that you plan on reaching out to, and by what, and what service are you doing? So make sure that you really take some time to be very to really define out what your program is doing. And also, we're holding you all to those objectives. So it's very important to be specific about your objectives. And we know that sometimes different things change in our environment as far as like maybe with healthcare services and access. So we understand, and we will work with you all. Don't get stressed about writing the objectives, because sometimes we do need to change them a little bit as far as numbers go. If you're seeing, say, for instance, if you're seeing more women getting covered through insurance, then you might not be paying for as many screening mammograms as you once did. But we can work on that down the road. So when you submit your application, just make sure that it's measurable, that it's specific, that there's a time period given, and that you also have that basis for evaluation. So if you give numbers and you give a timeline, that's good for you all, because then you have a plan of how you're going to make sure that your program is effective and is doing what it was funded to do. The evaluation piece is really important, and it's a lot of times it's something that we kind of pass over at times. But make sure that when you're going through your evaluation that you consider what happened, how much, where, to whom, and then also you can look at it in terms of impact evaluation. So like we were talking about earlier, did it change someone's behavior? Did it change their knowledge about something, their beliefs? And then also, who did it change? Like, did you go and educate providers? Did you educate individuals? And one thing that we've heard in some of our focus groups is that it still is a confusing message about when you should get screened, how often you should get screened, what does family history look like. There's a lot of new information and research that's coming out about who is, we always talk about the BRCA test, but what about other genetic testing and the fathers being the carriers. So make sure that you're reading up on that, and that might be areas that you want to educate as well. So there's a lot of different areas to improve in our communities about the knowledge of what's going on in terms of screening and and also in terms of where the resources are located. So that might be something that you want to educate individuals or providers that, you all are here, this is what you have, and how they can get that out to their patients as well. Budget and expenses. So the biggest thing, and I know that you all get tired of me saying it, but make sure that you justify every penny you ask for. And to be realistic, we want to make sure that we cover what will make your program run well. But sometimes we get requests for, we'll say $10,000 for TV ads. Well, you haven't told us, is this part of some type of marketing plan? Is it part of some type of education plan? And we need to know exactly how that fits into your program. We're not just going to be paying to just market like, hey, this is my grant. I mean, it has to be very specific and targeted. And I do also, I'll tell you that the marketing funding is somewhat hard. It's usually the first thing, honestly, the first thing cut in grant budgets, because panelists, the grant reviewers, really want to make sure that services are covered as well. So make sure the ones that do get covered usually really go over why it is so important. So if in your area it is, majority of the people that's your target group read the newspaper, then you need to make sure you've got some numbers and reasons why you need to have it ad in the newspaper and how it costs too. And also when you're doing your budget, there's a section usually underneath on gyms that has a place where you can write things out. So if you ask for, say, like a marketing budget of $500 and you're using that only for newspaper, make sure in that section that you write out, this is the newspaper, say we're going to use $50 for this many months and this many. So really lay it out for us so we know exactly what you're using with every penny. And it also shows the grant review panelists that you've done your homework and that you're not just asking for some random number, that you know exactly how much it costs, that you've talked to people involved, and you know exactly what they'll accept from you as well. Because sometimes when you talk to them, they might give you a good deal if you're buying for certain, for a certain amount. So we want to hear that too. We worked out a deal. This is what it's going to be. But always tie it back to why. Well, why do you need this? So if it's for screening, why do you need screening? If it's if you're doing a type of survivorship program, explain why you're asking for the money. So always justify, and also go back after you've done your budget and look at your narrative program description and make sure that they're synced, like that everything you've asked for is mentioned in your narrative too. Because like I said, we've had applications before that we never heard it even mentioned it as being part of the program, and then it's asked for in the budget. So, and I'm even talking if you're asking for supplies, like that's important to mention. We need this and this to conduct this education program. So please line out everything.
I'd like to say something too about this. Because of the Affordable Care Act, we believe there will be less need for screening money. So take that into consideration with the population that you're working with. That may or may not be the case for the Hispanic Latina group, that you may still need screening money to cover that group. But whatever it is your decision is about screening, how much screening you're going to do, make sure you've justified that and it's clear to us that you have taken the Affordable Care Act into consideration, the availability of insurance into consideration. Those insurance policies are all required to pay for screening mammograms for age-appropriate people at 100%. So you may not need any screening money or very little in your budget. Just want to warn you of that so that you can have, again, a realistic budget based on what is really going to happen.
Mm-hmm. And also, too, and this is a comment that the grant reviewers gave last year, is that if you're doing a program like, say, survivorship, and you are asking for $500 in prescription help, one of the things that we got feedback from reviewers was it would be nice if they included either the application for what that looks like or the guidelines. So say, I'm sure all of you have a limit that you set. Like I know Hope has a certain amount of money per month and then a certain amount of months. And so whatever it is that your limit is, you know, I would mention that, or you might even just have that on a different sheet and just include it into your application on one of the pages, where if you there's only a couple pages that let you download or upload something into the application. So just making sure that if you do upload it, make sure you save it with a name that's really recognizable. So, you know, you could say like program procedure or program rules or something like that. So, but just make sure, because a lot of our grant review panelists, they come from all walks of life. And so I know we had 3 or 4 that were in the business realm, and they really, really, I promise you, looked really closely at your budget. And they looked to make sure that every single penny was justified, and they wanted to know as much as possible. So if you're doing something like that, where it's, you know, gas cards or something like that, if you explain the process of how you approve, or, you know, if you have a limit, or if you, how do you give those out, that would be good too. So including with that, like I just said, if you're asking for money for, you know, survivorship issues, also in your application to put information, these are things that you'll want to upload, is your information regarding key personnel. And so if you already have someone working on the program, like say for instance you had this Komen grant last year, and it's basically a similar program and the same person is going to run it, we still need their bio or resume into our system. Now if you haven't hired someone, if it'll be a new position, then we need the job description that you all will be hiring into the application. Also, the proof of tax exempt status. This is, you have to get the proof. So work on it now. If you all, you know, it's hidden under documents and documents, find it now. I know you all, if you've applied for a Komen grant, have entered this information before. They're working on getting it where if you've entered it, you don't have to keep entering it, but from what I know, you still are going to have to enter it this year. Also, this was new, I think, as of last year, is making sure that you have the letters of support, collaboration, or MOUs. And just want to make sure that we talk this through, is that letters of, we really want to know who are, if you're we call them a pass-through grant. So if you're not located directly in a hospital, we need to see letters of that you have an agreement with a certain area, like for instance with the breast center, that they agree to 130%, and making sure that we're all okay with the agreed upon amount. You don't necessarily need to list each service and the amount of money, but at least having that they will agree to the Komen funding guideline of that. So you probably want to start working on that right away, because I know that some organizations take a little bit of time to get those out to you. So just know that, you know, we need to get that. Now I know in some other grants, especially federal grants, that a lot of times any organization that you work together with, they want letters of support. We're not asking for that right now. We're just asking for really an agreement between you and whoever's providing services at a cost to you, to make sure that they know that you can only pay a certain amount, and to agree upon that. Do you have anything to add? So then the next part is evaluation forms, surveys, logic model. These are all important and help the reviewers and our grant committee to see that you all have a good evaluation plan. You talk about it in your application, but I would really encourage other forms of documentation of your evaluation. So do you, I know some of the breast health navigators, they do patient surveys, and or maybe your education program is going to do a survey. So I would include it into your application to make sure that we know exactly how you're evaluating it. And then also the funding history. We would ask to go ahead and include that on your application. They do have it. If you look at in your application, I believe it's on in GEMS. I believe it's on one of the first or second pages in GEMS. It does have a funding history that GEMS pulls for you, but and you you don't have to upload the funding history if that's correct. But sometimes some organizations have had maybe name changes, or we've put them in as one. Those would be an organization that you'd want to give the funding history. So if your history is not correct, then please just make sure that you attach that. And then the allowable expenses, yeah. Okay, so they're similar to what we've always had, and the allowable are things like, we do allow for salaries, but like I said, just make sure that your program and that your grant reflects on why you need a salaried person to help. So, you know, what time they're going to be spending on the grant. And if they're not 100% on the grant, then you'll need to reflect that too.
I just want to jump in here too and say about salaries. Our review panels in the past have also been very critical of salaries, and we are doing our best to explain to them that because of the Affordable Care Act, we're not going to be paying as much for services, and so salaries are going to be an important part of conducting these programs that you're developing. So I can't say enough about how important it is to describe what the person is going to do and how that is essential to conducting this program, because that's how you're going to convince them that, in fact, they need to give you the money for the salaries. You know, I hate to be a downer on that, but I want to be direct, and I want you to understand how important that piece is in this as we are making this change. We don't always have the same reviewers year after year, but we do have some. And so sometimes those are our battles to get those people who are returning to understand how what the changes are in the grants. And I'll say here too that Lauren and I are trying to be as clear and specific to you as possible with this grant application, because we are focusing differently than we have in the past. I want you to understand that our priorities are different than they were, so you'll need to follow along with the game.
Mm-hmm. And also just to add, and we'll add it again, is that if you have any questions about whether something would be good to put in your application, whether it makes sense, whether, you know, if you're like, I'm not sure if they would even go for that for funding purposes, if you want to give Sarah and I a call or an email, we'll be happy to kind of talk you through it too. We can't promise. I mean, Sarah and I have no influence over the if you're funded or not and for how much. But just to know that we can say, well, in the past, these are what committees have commented on, and this is what we've heard, this is what we've seen, or no, we know they won't fund it. So we can say things like that. So please, you know, we want to help you through this process. So we don't want this webinar being the last time you hear from us. So please, you know, email, phone call, and the earlier you do it before the deadline, the better information you're going to get from us too, and we can spend some time talking you through it too. But like I said, it's really the same as last year. The indirect costs also are something that get cut a lot as well, and because a lot of times our grant review panels are like, well, they could get that donated or they can get that in kind. So if you have, so when you're writing these costs, think about that through maybe a grant reviewer's eyes who are trying to save money to make sure that they're covering a service area. So you know, maybe say we've discussed this, we've worked out this rate, because then it looks like you've done your homework and that you've really put in thought, and you'll say that we do need this money because it won't happen if we don't have it. So that's what they want to hear in order to justify costs, especially like indirect. Funds may not be used for, these are, you know, the regular ones that we've always had. We did add the projects completed before the date of grant approval as well. You all know that, but we want to make sure that it's outlined. And then there's, but it's the same information, and it's, you know, common sense as well about what we're not going to be approving funds for. And one area, though, that is changing, and it changed last year, but we want to really emphasize it this year because we did happen to see it in a couple applications and reports. So Sarah's going to go over that because she can explain a lot better than I can.
So there's a lot of information out there. Everybody seems to have an opinion about mammography these days, and some of them go along with the Komen philosophies, and some of them do not. And so we want to be sure that we are all on the same page about what the recommendations are for screening mammograms, and just in general the educational messages that Komen has through scientific research and understanding about the broad understanding of the topic. They have made certain recommendations. So do visit the Komen.org website and get a good understanding about what the educational messages are, and the material, so that materials that you're providing to patients and the programs that you're providing to patients will be consistent with the Komen philosophies. Komen does not recommend monthly self-breast examinations. I will explain this to you. I was appalled when I heard this, as many of us in the medical field were. However, when I went to the training, I began to understand what they're talking about. The focus in the past has been on do it exactly this way, once a month, just like this, which has been a turnoff to many, many women, and they have not followed that. Instead, what Komen is trying to get across is that women need to know what their breasts are like under normal circumstances so that they can identify things that change and become abnormal. They no longer recommend the specific self-breast examination or the use of breast models, because neither one of those tools has helped, has been specific in the way it helps women to identify breast cancer in themselves. So the message that Komen wants to get across is that women should know what their breasts are like and report differences, and that's it. Because there are women out there who thought that the only way that you're going to find a breast cancer is if you do this examination, and ignored some of the other signs that were important for to identify the breast cancer. So just reiterating that and helping you to understand that, and to go out and explain that to other people, in particular in the medical community, who might still not understand why on earth Komen would not recommend monthly breast self-exams. If you don't understand that, we can continue to talk about that. I'm happy to email or talk to you on the phone to help give you words to help spread that message. Komen's not the only organization who has undertaken this this change in their philosophy. So I'm going to tell you about how the review process works, and I may or may not go along with the slides. When you turn in your applications, there is a small committee of volunteers who will read through those applications to be sure that they comply with the rules. We have a set of rules that are based on the RFA that you have received, and if you fall outside of compliance, we will notify you, and we will give you an opportunity to make changes. If your grant application just simply doesn't follow at all, we're only going to give you a few days of opportunity to make those changes. So you may be just turned down, period. But I'm not expecting that out of any of you. But we will give you an opportunity to make the minor changes, to provide documentation that we realize is missing, that sort of thing. After we've gone through the compliance, the applications are released to the grant review panel. Now that panel, like Lauren said, is made up of a broad spectrum of community members. They could be survivors, they could be people in the medical field, they could be people in the business field, and they are all of those things. And we always keep that panel anonymous to protect them from any of you and your influence toward them for to influence them toward your grant. 5 members of those that grant panel are going to read your grant from beginning to end. As Lauren said, the rest of them will get your abstract, but there will only be 5 who will read the whole thing. So that's the reason why we want you to make sure your abstract gives a real flavor for what it is you're trying to accomplish and does it in a way that is grammatically correct and pleasant to read.
Yeah.
Those 5 members that are reading it, reading your application, will score it based on the different sections and the priorities that we have talked about in your RFA. And then the entire group will talk about it and come to a final decision as to how we're going to score your grant. And whether or not we're going to fund your grant, or we might approve your grant but not have the funding to be able to cover your grant. That slate of information will be given to the Board of Directors, and they will make the final decision based on the slate. And then Lauren jumps in and begins to contact all of you and talk about contracts and all of those kinds of things.
And also, if you're not familiar with the approved but not funded, because not every year we do that, depending on the money, the application, what the review panel wants. But basically, if we get, if you're approved and say we do really well on the next fundraiser we're having, or we get a huge donation in, or something happens where we've, some money is shuffled around, then there is that opportunity where we then could fund the grant or fund some of it. So, there might be down the road, if you were approved but we just didn't have the money, that we do get the money. I mean, that is a possibility, but it's always up in the air. So if you are approved and not funded, there is a possibility that we find the money, or have, like I said, do really well at one of our events. But that's kind of what it is. So if you get that notification, that's what that means.
So in the review process, the reviewers are going to be looking at these 5 categories and scoring your grants on these 5 categories. So as we've talked before, you need to talk about what is the impact? How is this going to turn out? Is it going to impact a few women very strongly? Is it going to impact a broad community in a specific but less strong way? How likely is it that what you'd like to have happen really will happen? Prove that you have prove that it's a good idea and that you have the capacity to make it happen. Talk about your collaborations with other agencies, how, for instance, you're going to refer a patient on for treatment if what your grant is all about is to get the patients through diagnosis. What's going to happen next? How are they going to have the resources that they need? And who specifically will you be referring them to get those resources? And then the sustainability. How likely is this program that you've developed going to proceed on into the future? Understandably, some programs are not things that continue forever and ever, but hopefully they have an effect that continues on. If your program is developed as a specific education program that you do it and it's over, how's that going to change people for the future? And that explains the sustainability of that program. These are some important parts too that we'd like to see in your application. How specifically are you going to screen clients for breast care, or if you are funding, or if your program addresses women in Missouri, the Show Me Healthy Women program? How are they going to be screened, and how are you going to refer them appropriately into those programs? How are you going to determine what clients are eligible? For instance, if you have determined that they are not eligible for breast care, do you have a financial guideline that makes that client eligible or not eligible? You need to be certain that your cost estimates are less than 130% of Medicare, and the best way to do that is to have a letter of agreement, as Lauren said, with the providers that you're going to be referring patients to. And then Lauren talked about your marketing plan. how are the services going to be accessible to patients, and how are they going to find out about it? Well, if purchasing newspaper ads or putting advertisement on television or whichever you determine is the best way to get clients to know, be specific about that and be clear that you have researched that and you understand that that is the best way in your community to make these clients aware of the program. And again, be specific about how you're going to educate patients, how that's going to have an impact on them, how you're going to measure that impact, and just be specific on your education programs as well.
Okay, and one thing that I didn't include in the presentation and came to mind is that as of last year, we all made it mandatory that you had a certain insurance coverage. That was a new change with Komen National. It won't be an issue until contracts come up, but what we're doing, what we did last year and what we'll do this year again until our board considers that we shouldn't, is we look at the, I believe it's in the RFA, about the amount of money that you need to be insured and that you need to write Komen Ozark in to have it into your insurance as a writer. And so look at the qualifications and what's needed, and then see if your organization can do that. And if they can, then that's great, and we'll get that information when we sign the contracts. But if it's going to be a burden, as far as financial burden on your organization, to make sure that you have the amount of coverage that's being asked for, then you need to contact me and talk about it. And what I'll just ask for is just some documentation about why it's a burden, why that you wouldn't be able to get that amount of insurance. And then our board has agreed to look at each case as a case-by-case basis as to whether or not they will grant a waiver over having that certain amount of insurance. So if you have questions about that, just give us a call. But some of you all had already did this last year, so you know what I'm talking about. You will just send in something similar. But it's better to get that looked at and taken care of ahead of time, because like while you're applying, to make sure that that's something that you all can cover. So if you are funded, we will let you know in March, and what happens after that. So first is a contract. It's a non-negotiable contract. It will be available in gyms for the authorized signer. If there is something in the contract that you all cannot agree to, the organization cannot agree to, you can ask the affiliate board to have a waiver for a certain specific thing. But we rarely get that, and rarely grant a waiver as well, because the contract has been vetted by national and our legal counsel. But you can try. It is a process, though. But if you hold a Komen grant currently, the contract really hasn't changed much, so it's not something you need to worry about. Also, we will offer training in April 2015. We'd like to continue to keep that training a face-to-face training. So just know that we will, if you all get approved for funding, we all will let you know that date of when the training will be, and it is mandatory, because we'll be going over things like how to do your grant, how to report, when reports are due, site visits, things like that. Which brings me to the reports. We do ask that all of our reports and site visits are mandatory. We do quarterly reports. We do a 6-month progress report, and then a final report that is conducted 45 days after the end of your grant. So those all will be conducted in gyms. If we do have an issue about compliancy, as far as no matter if it's like, having problem budgeting or any type of compliancy issue, maybe you've turned in reports late or things like that, then we do have the right to change reporting. So we might go to monthly reports, or we might ask for weekly reports. So just know that if there are some compliancy issues that the grants committee and board has in the past and currently has asked for additional reports. So always what I say is that If you do get funded, just let me know what's going on so I can keep everybody updated so we're never surprised. So that's just kind of rule of thumb. And we'll go over that if you do get funded at our grant meeting. And then also we do conduct site visits around the 6-month period of our grants, and we conduct them on everyone. It's not you're in trouble, we're coming. So just know that we will have that too. That will be a requirement of the grant.
A site visit is actually an opportunity to bring our board members to your site and help them to see what you're doing and how wonderful a job you're doing. And it's really very helpful to them and very rewarding to them to see what's going out there in the community.
Mm-hmm. And then also, like I mentioned, failure to report on time may jeopardize installment payments or future funding. It also may have additional reporting, like I mentioned earlier. Funds awarded with a grant period can only be used if services are rendered during that same grant year. So if the service was conducted before you were given grant funding, you cannot pay for that service once you receive the grant funding. So we just need to make sure that those services are conducted within the grant period that you are funded for. And then unused funds that are over $1 must be returned with the final report. So once you wrap up your grant, make sure that you are always keeping an eye on your budget, but know that we do have to have those unused funds back. It's not we give you money and then you use it until it's up. We do have a time limit, and we will be asking for the money back if you have funding left over, which we always hope that you don't. So we always want to make sure that we're serving women and getting them, because then we know you've kept an eye on your budget, and we want to get close to zero as possible. So I'm not sure. I'm going to look and see if anybody's asked any questions. If you have any questions, if you can type them into the box on the right, we will get to them. And I'll just keep talking for a minute in case we have any questions. You can always contact Sarah Fatak or I about questions regarding your grant or regarding the process. So if you just don't want to ask them today, you can always ask them at another time, and we'll be happy to answer. But especially reading through that RFA really well and seeing what our changes in our grant is going to be, you might have some more questions down the road. So we're happy to answer those questions for you, but I'm not seeing any questions now, so I'm hoping that means that we answered a lot of them for you already. And I will say, want to make sure that I let everybody know that October is Breast Cancer Awareness Month. I'm sure all of you are aware of that. We actually just started our 6-week focus on Sunday, that we have a regional plan for social media that is doing lots of educational and stories and content update every day. So if you all do Facebook, we're on there at Komen Ozark. We are on Instagram, Twitter, Pinterest. We have a blog too. So please follow and retweet, share, comment, like on our information, because we really want to make sure we're getting information out there to the masses. So please help us in our efforts for that. Let's see. So I do see one question here. Can you put up the website address for the Medicare allowable site? So we will have that. It is in your PowerPoint. So I will make sure, I think Shauna that was asked that question. I'll make sure that I send out that PowerPoint presentation for you all so you have it, so you don't have to write it down. And we'll make sure that you guys have the presentation. Okay, are there any other questions? Okay, I'm not seeing any. Is there anything you'd like to add additionally?
No, good luck, and know we support you out there.
Great. Well, thank you for joining us today. And like I said, November 11th, your application is due. So if you have any questions, like I said, don't hesitate to call. Thank you.